Hey, Kristen.
Hi.
How are you doing today?
Oh, okay.
Good. I'm really glad to have you back here again. I am doing well.
Good.
I'm kind of a little bit spacey today, so I want to be upfront with you about that if there's any point that I space, it's nothing to do with you. It's nothing that you've done. I'll make sure to acknowledge it so that it's not just like this awkward elephant in the room. So before we get started, just remember that everything you say is going to be confidential. The only exception to that is child abuse and neglect, if you're telling me stuff about that. And I think that it's something that needs reported. I'll let you know that I'm reporting it. We'll sit down together, have a conversation, and then I will have to report it.
Okay.
Also, same rules apply for if you're going to hurt yourself or someone else.
Okay.
I have to report that too. So the last couple of weeks, we've done a lot of talking about you wanting to eat healthy and exercise. If you would like to continue talking about that today, we can, but I'd like to open it up for you to kind of guide this session.
Okay.
So what would you like to talk about?
One thing that's been on my mind a lot is like after graduation of what to do. My practicum's not fully offered me a job, but they've talked about it.
Okay.
And like next semester I'll get ready to start my own therapy with my own patients and everything. So I'm kind of overwhelmed with a lot of that. So that might be a good topic to discuss.
Yeah, definitely. So you said that you're overwhelmed. Can you identify a couple of other feelings? Overwhelmed is a really big blanket statement of maybe some underlying thoughts and feelings.
Yeah. I would say one of them is scared.
Okay.
Kind of maybe not well prepared.
Okay.
And I don't think that's like a reflection of anyone else. I think it's just not feeling adequate.
What makes you feel that way?
I think because I'm young and I don't have a lot of experience. Like, I got my bachelor's, and now I'm in my master's program, so it's just kind of like bam, bam, and not a lot of like work experience. So that kind of makes me feel less prepared than other people.
Okay.
Anxious, also excited though. So kind of a mix of things.
It's a big next step. So all of those feelings are super, super valid, and I would say really normal.
Yeah.
I think that every student comes out of school feeling unprepared.
Sure.
But I will say, I am sure you will get into the field and realize you're so much more prepared than you think. And a lot of social work is those natural qualities, and you seem to have those.
Thank you.
You've got this, but I know that words don't always like validate that. It's easy to continue feeling like you're not enough. You said that you're anxious. Can you tell me what that presents as?
I think like right now I stumble over my words a lot, and kind of when I'm talking to my supervisor or just anyone I work with, and that I think it shows a sign of my anxiety in that way, just that I lose my train of thought, or like just something happens within me where I don't feel super confident. And then also sleep, I just have a more difficulty falling asleep now and like staying asleep throughout the night.
Okay.
So.
Okay. When you say that you have a difficulty falling and staying asleep, can you explain that a little bit more?
Normally, like I'll get into bed at 10 or before that because I like to go to bed early, and then it takes me probably 30 minutes to an hour to fall asleep, and then I'll wake up 4 or 5 times throughout the night.
Okay. And when it's difficult to fall asleep, is that because you've got too many thoughts inside your head, or is your head empty and it's just a struggle?
Yeah, my mind will shut off.
Your mind will shut off. Okay. So that's also a normal thing, especially when you've got a lot of stressors in your life, which you've said you do. Would you be open to learning kind of a little exercise to clear your mind before bed? Okay. So I'm really big on like mindfulness and being in the moment and present. So there's a few things that you can do.
Okay.
The first of which is the 5, 4, 3, 2, 1 exercise, which being that you're in social work, you've heard of it. But you're just acknowledging the things around you. So I would start with that to kind of clear your mind.
Okay.
So 5 things, I'm not positive exactly how it goes, but 5 things that you can see in the room, 4 things that you can hear, 3 things that you can smell, 2 things that you can taste, or that you can, taste, I believe. And so you've got all your senses there. You're going to go through and acknowledge all of those, and then to just take a couple minutes, start off with breathing. You'll transition into some breathing. Take a breath in for 7 seconds, hold it for 4, and then let it out for 5. And then just do that. So your mind's clear and then you're focused on your breathing.
Okay.
Does that all make sense?
Yeah.
I know it was kind of a jumble.